Bismillahirrahmanirrahim. Once again, welcome back to Guytonacademy. Today I come with experiment number 4, and this is the VIVA and OSPE question guide with related to the experiment Erythrocyte Sedimentation Rate by Westergren Method. This guide is basically for the MBBS, BDS, nursing, DPT, and whatever students are learning physiology. This practical is included in all the disciplines of physiology, so it will be helpful for everyone. Requirements are very simple. We need some tubes for this is with anticoagulant so that blood will not coagulate, and this is the ESR stand with tubes, and this is sodium citrate solution, and these are Westergren tubes. We will further discuss the requirement, but this is the basic requirement for ESR practical. First of all, we have to differentiate between two tubes. This long one is basically Westergren pipette. Pipette is basically open at both the ends. However, a tube is open at one end. But in many books, in many presentations, or in websites, you will see Westergren tube word is also used. So it's okay. But you have to remember that Westergren tube is longer in size, Winthrop tube is shorter in size, right? So Westergren pipette is basically a standardized tube used for the ESR practical. However, we can also perform ESR with the help of Winthrop tube, but this is not recommended. So in our experiment, in our lab, we use Westergren method, because we are using Westergren pipette for this experiment. So Winthrop tube is small in size and closed at one end, and this Westergren tube is longer in size and open at both the ends. So this is the marking. You can differentiate between these two. Now, if in your exam this type of picture is present, you have to identify the experimental setup, right? Experimental setup and tube name. So this experimental setup is the setup for erythrocyte sedimentation rate by using Westergren tubes or Westergren method. All these are the Westergren tubes. We can have a minor difference in the stands, but overall this is Westergren tube for the ESR, for the measurement of erythrocyte sedimentation rate. Now we have many questions related to this topic. First of all, define erythrocyte sedimentation rate in human subjects. Basically, ESR is a blood test that measures the rate, that is speed at which red blood cells settle at the bottom of the test tube in 1 hour. So remember the time duration. It is the rate. Rate is always in the unit of hour, minute, or second. So, but ESR is measured in 1 hour. The process is called sedimentation and measured as length of the plasma column in the Westergren tube after 1 hour. For example, this is the Westergren tube, and we have placed the blood up to this level. After 1 hour, it will settle down, RBCs will settle down, and upper part will show you the plasma level, right? So we will measure this level, right? And this will give you the value of erythrocyte sedimentation rate after 1 hour. So here we see that ESR is a blood test that measures the rate at which the red blood cells settle down at the bottom of the test tube in 1 hour. The process is called sedimentation because cells are settled down, and the measured as length of the plasma column in the Westergren tube after 1 hour. Its unit is millimeter per hour because tube is marked with millimeters. ESR stands for, this question also come in your exam. I saw in many times that this is present in your OSPE. So erythrocyte sedimentation rate, very easy, and its unit is millimeter per hour. What materials are needed for an ESR test? The materials required for ESR include a Westergren pipette, anticoagulant, mostly EDTA, or sometimes there may be any other, an anticoagulated blood sample, because we don't need any blood which is clotted, right? So we have to place the anticoagulant, or we take the blood already in the anticoagulant tube. So anticoagulated blood sample, a stopwatch or timer to measure the sedimentation rate. For example, we set our timer at 1 hour. So these are the requirements. Uh, mostly we use sodium citrate solution. Which anticoagulant is added to the blood for the ESR testing using the Westergren method? For the Westergren method, we use 3.8% sodium citrate solution as an anticoagulant. Okay. Usually EDTA is an anticoagulant, but for this practical, particularly for this practical, we use 3.8% sodium citrate solution as anticoagulant. Okay. How is ESR test performed? What is the Westergren method of ESR? The ESR test is performed by using Westergren method involving filling a calibrated vertical tube, which is also known as Westergren pipette, with anticoagulated blood, and measure the distance in millimeter that red blood cells fall in 1 hour. This is how we read the ESR. What is the Westergren pipette used for? It is used to measure the erythrocyte sedimentation rate. घुमा के same question किए जाते हैं. So I have repeated few questions in different way. So you will memorize this during the video watching, inshallah. What is the normal ESR range in the male and females? Remember, the ESR is always higher in females than males, right? So the females, it is 0 to 2 millimeter per hour. In males, it is 0 to 15 millimeter per hour. For children, it is 0 to 10 millimeter per hour. For newborn, it is 0 to 2 millimeter per hour. So you have to memorize these values. What is the clinical importance of ESR? ESR is useful screening test for detecting inflammation, infections, autoimmune disorders, and some cancers. This question is commonly come in your OSPE. What is the purpose of doing ESR examination? Or if you have a report of ESR and it is very high, what does it indicate? So remember, the simplest answer is inflammation and infection. The most simplest answer is inflammation and infection, and whatever other options you have memorized you can ask, but the most simple thing is the inflammation and infection. Mention the conditions in which there is high level of ESR. An increased ESR may indicate the presence of pregnancy, anemia, inflammation, acute and chronic infection, tuberculosis, rheumatoid fever, autoimmune diseases, malignancy, multiple myeloma. These are the conditions with the high ESR. Mention the conditions in which there is decreased level of ESR. ESR is decreased in polycythemia, sickle cell diseases, decreased fibrinogen levels, reduced inflammation, hyperviscosity, polycythemia, sickle cell anemia, spherocytosis, and microcytosis. Here I have mentioned anemia with high level of ESR. So try not to mention anemia, because in some type of anemia there is increased ESR, and in some type of anemia there is decreased ESR. Right? Here you can see in a sickle cell anemia, the ESR is decreased. What factors influences ESR? Roulex formation and plasma protein concentration. These are the two important factors that influence the ESR. What are the stages of RBC sedimentation? First, our Rulex formation. Basically, we wait up to the Rulex formation. However, the stages of sedimentation include, first of all, the Rulex formation. Next half hour, constant rate settling of the aggregates. That is, the RBCs become aggregated, and then they slowly settle down as RBC pack, all packed, jam pack. What is the Rulex formation basically? Rulex formation refer to stacking of red blood cells resembling a roll of coin. Like we put the coin one on each other. This is the stacking. So this is how the RBCs get stack up. It occurs due to increased plasma protein, for example, fibrinogen, globulin, that reduces the negative charge on the RBC surface, causing them to stick together. So remember which proteins are responsible for the increased ESR or increased Rulex formation. These are two important proteins, fibrinogen and globulin, that reduces the negative charge on the RBC surface and increases the Rulex formation. Rulex formation increase viscosity of the plasma because there is increase in the proteins, which are plasma proteins. When the plasma proteins is more, plasma will be more viscous. How does Rulex formation affect the ESR? Rulex formation decreases the surface area of red blood cells, reducing plasma opposition to sedimentation, and increases the ESR. Which plasma protein affect the ESR? Fibrinogen and alpha and beta globulin increases the ESR by promoting Rulex formation, while albumin, remember, albumin decreases the ESR. How does RBC count affect ESR? Lower RBC count, more Rulex formation, more ESR. Lower RBC count, more Rulex formation, more ESR. How to read ESR tube to find ESR? I mean to find out the value of ESR. The ESR measures the high level. ESR measures the height of the column of the plasma at the top of the tube after 1 hour. At low ESR means few cells have settled down. A high ESR means a lot of cells have settled down, which can suggest inflammation. Why is the ESR value more in females than males? In females, ESR values are higher due to hormonal differences, the influence of menstruation, pregnancy, and lactation, which can affect plasma protein levels, particularly fibrinogen, which is associated with increased inflammation. What is the cause of sedimentation? Sedimentation occurs due to the aggregation of red blood cells influenced by the factors as plasma proteins like fibrinogen and globulin that increases the inflammatory states. These proteins promote the sedimentation. I know some questions are repeating, but it will help you memorize these questions. Why is the ESR increase in diseases? An increased ESR is in disease often indicate inflammation, infection, or tissue damage, which leads to elevated levels of acute phase reactants such as fibrinogen in the plasma, promoting the faster sedimentation of red blood cells. What happened to the red blood cells in a column of blood that is allowed to stand vertically? The red blood cells settle downwards due to their higher density compared to plasma. What is ESR in anemia? In anemia, ESR may be increased or decreased depending on the type of the anemia. For example, in iron deficiency anemia, the ESR is often increased due to associated inflammation. What is the ESR in chronic infections like tuberculosis? In tuberculosis, there is elevated level of fibrinogen and globulin, so there is increased ESR. What is the ESR in rheumatoid arthritis? Rheumatoid arthritis, the ESR is typically elevated due to inflammatory nature of the disease and the presence of acute phase reactants. Remember, in acute phase reactants are fibrinogen. What is the ESR in multiple myeloma? In multiple myeloma, the ESR is usually elevated due to increased plasma proteins and the inflammatory responses associated with the disease. What is the ESR in polycythemia? In polycythemia, ESR is generally decreased because the increased red blood cell mass can lead to slower sedimentation rate because you have lots of red blood cells that will take more time to settle down. So in the polycythemia, ESR is decreased. What is the ESR in the liver disease? In the liver disease, ESR can be elevated due to increased production of inflammatory markers and plasma proteins. You know, inflammatory markers are fibrinogen. So in liver diseases, fibrinogen levels can increase due to liver damage, which leads to higher erythrocyte sedimentation rate. What is the ESR in congestive heart failure? In congestive heart failure, the ESR is often elevated due to associated inflammation and fluid retention, affecting the plasma viscosity. What is ESR in cancer and tumor? The ESR is typically elevated because of inflammation and altered plasma protein levels in the case of cancer and tumor. What precautions should be taken during ESR testing? Avoid air bubbles and vibrations, means when you put the blood into the tube, there should be no bubble in it. And don't touch the tube again and again. The tube must be vertical and undisturbed. Mouth pipetting should be avoided because this is blood and unhygienic. Use proper anticoagulant concentrations so that blood will not clot. Thank you so much. I will appreciate if you like my video, subscribe my channel and give some comments related to the content I created for you. I hope it will be very beneficial for your practical exam. Thank you so much.